I'm here with Ashish Sharma. Ashish, you have a very, very clever thing that you're showing. You know, I've read some articles in which people have taken photos of the retina with a smartphone and a 20, and I imagine it's possible. It's very awkward. There, you need both hands to coordinate things. But you've sort of solved this problem. Can I get you to talk about your device, and then we're going to see some examples.
Okay, great. Thanks for having me here. So basically, we designed MII Ret Cam. MII Ret Cam is a fundus imaging device, smartphone based obviously, which can image the retina right from the optic distal, ora serrata, and pars plana. And to the best of our knowledge, this is the first device in the world which has capability of imaging right till ora serrata. Actually, it overcomes a lot of shortcomings of existing fundus cameras. For example, as you rightly said, that the coordination is really difficult. So this device can be operated with one hand completely. So your other hand is completely free. You can maneuver the eye the way you want. And the other thing is, it is not limited to the iPhones. You can actually use Android phones, iPhones, both. And third thing is, you do not need any additional light source for it. Actually, you can utilize the smartphone light source itself. And the most important thing is, it is not slit lamp dependent. You can take it wherever you want. So that's where we identified need, particularly from the country where I belong, India. We identified need especially in three areas. First is, whenever a resident starts his own solo clinic, it is very difficult for him to afford really costly fundus cameras, which doesn't do the complete job. Here, this could be a wonderful tool for them. Second is, whenever residents they are getting trained, especially showing them peripheral lesions cuts down their learning curve. And in our country, it is very difficult to have indirect mount CCTV cameras everywhere in each hospital. So this can be a wonderful tool for them. And third is, I belong to a country where 1/6 of the world population lives in. So we need to screen all of them. We need to have contribution in the avoidable blindness. So this could be a wonderful tool for it.
Now we're going to bring up a picture of the device. Tell me what I'm seeing here. What's this arm on the bottom, and what is this little screw on the side?
Yeah, so basically this is a ball rotator. That's where you increase the functionality. You don't limit it to the iPhones, because with the help of this you have a rotation 35 degree on the right side, 35 degree on the left side. So it doesn't matter where exactly your camera is located on the smartphone. Whether it's on the top right, whether it's on the top left, or it's in the center, you can just rotate with the ball rotator and it does the job.
And then I hold the device in one hand.
Yes, true.
And maneuver it in the same way that I would just holding a 20.
Yeah.
Yeah. Oh, neat. And then you find that the coaxial light source, what we call the flash for the cameras. Of course, it's not really a flash.
Yeah.
That's adequate to get in.
That's pretty adequate. Actually, sometimes we need to decrease it.
Really?
Sometimes.
So you brought some examples of some images that you shot. The first one is of a patient with diabetic retinopathy.
Yeah, this is a diabetic retinopathy. You can see the hard exudates floating around everywhere, and even they are coming towards the macula. So this is the central fundus that we have taken with this device.
And this is really a very clear photo. I mean, I can clearly see what's going on. Doesn't seem to be much compromise. Now I have a digital fundus camera in my practice, and it's wonderful. One of its limitations is I can't get very far out in the retina with it. You can see peripheral lesions with this device?
Yes, that's where the most important functionality lies in. You can actually image till ora serrata and the pars plana, and you can show the next picture that we are showing, that horseshoe tear, which is located right adjacent to the ora serrata.
And then these are laser burns that
these
I'm
are the
seeing?
laser burns. They are the old laser burn that we did.
Yeah, really marvelous stuff. Now, is this device that you're showing, this is a one-off, or is this something that you intend to commercialize?
Yeah, we are trying to commercialize it. So if somebody wants to know more information is available at www.miiretcam.com.
And to be clear, you have, of course, you have a financial interest in
I do.
this.
I do.
Yeah, well, which is reasonable. Ashish, this is really, really neat stuff. I'm delighted that you brought it to us. It's more than just clever. I'd love to try it out. I thank you very much for bringing this to us and for being so very generous with your time with us today.
Thank you so much for having me here. It's a pleasure being all the time.